Anybody got any burning questions before we pass on to Emma's presentation?
Paula, can I just ask, is there a chat facility on Zoom that we're not able to access? Because some of us can see it and some of us can't.
Everyone should be able to access it, Naheed. If you can and you're able to go into the feed loop at the same time, which you should be able to do, there's the chat function there that Joanna, a colleague, is monitoring as well. But have you got a question? Or is it just in relation to the chat? You're on mute, Naheed.
No, that was it. We were discussing it in the breakout room.
Anybody else have a question before we pass on to Emma? No, I think one just very quickly. I know Tony was trying to comment in 15 seconds and we didn't manage to do it, but I think the consideration for us within the EPIC theme is perhaps thinking about, we already have collaborations internally with the data teams via improving population health and care and health informatics, but also for us to think about maybe some of the clinical considerations from a research perspective about place, quality, community engagement, and Tony's theme within personalised complex care. So maybe that's a conversation, Tony, that the theme can pick up with you post ARCFEST. We'd be really interested to have that conversation with you. Joanna, you're raising your hand.
Yeah, just some comments from Feedloop. Comments more than questions. Rebecca West says, really interesting. I'm interested in the impact of community engagement, of making change, developing solutions. Neil Joseph said, any long-term impact and improvement would need a concerted effort to guarantee buy-in from corporations, local business. Tony Mars, would be good to continue the conversation about the interaction between the EPHC, the EPIC theme, and PCCC.
Thanks for that, Joanna. I think all the comments are really relevant. I think it's what is the offer to the system, and I think what we need to do from the evidence and the research that we undertake is be able to craft it so it talks to individual organisations and gets buy-in from them. So it's constantly about refreshing and reframing our conversations and what that means, whether that be for CCGs, whether that be for internal teams within ARC, whether that be for members of the community and others. And I think there's a skill to doing that, but obviously it's something that we need to take on and develop over time. So thank you for those comments. The next research project that you're going to hear about is from Emma Halliday, and she'll be talking about the role of the VCFSE sector in emerging and developing integrated health and care systems. Thank you, Emma.
Can you see my screen okay? Yeah.
Yeah, we can, thank you.
Right. Yeah, I noticed a few people I don't think are muted, just in case of feedback, because I'm doing this live, if people could just check they are muted, that'd be really helpful, thank you. So I'm going to try and move this on. I'm going to talk briefly to three main points. As the title alluded to, where the focus is on looking at the voluntary community, faith and social enterprise sector, or the VCFSE sector, and its role in integrated care. So I'll briefly set the scene for that and just say briefly a little bit more about that. But then want to move on to talk about the development of an emerging model for engaging VCFSE organisations in Lancashire and South Cumbria. And that's based on research that EPIC's been involved with in the last few months. And then finally, I'll just set out a couple of suggestions for where this research could go next, because it is at a very early stage and there's lots of opportunities to look at how the ARC can shape that. I'm conscious I've already probably mentioned about 3 acronyms, so I'll just briefly draw your attention to the main ones which I'll use. So the first one is the VCFSE, voluntary community faith and social enterprise sector. It's the main term you'll see on the slides, but it's a mouthful to say repeatedly. So you might hear me use that interchangeably with voluntary sector or voluntary and community sector. And then the next acronyms are the ICS and ICPs, which refer to integrated care systems and integrated care pathways. And I'll explain what I mean by these in the next couple of slides. So as I've talked about, the setting for the research is very much placed within the move towards a more integrated approach to health and care. And integrated care, I guess, at its very sort of simplest level, could be described as a way of organisations and groups who are involved in health and care joining up locally and working more closely together to achieve improvements in health that better meet the needs of their local populations. And as the illustration on this slide illustrates, in a particular locality or place, that might include a whole range of health and social care services, as well as directly involving the community, as well as the community and voluntary sector. So there are a number of different arguments or reasons why systems should begin to partnership more formally with VCFSE sector organisations. And this slide lists 4 main reasons which a national programme called the NHS Voluntary Partnerships Programme have positioned. And these are reasons which you may agree or disagree with, or you may have other suggestions as well, which aren't listed here. So referring to the current role that the sector plays as service deliverers and co-producers of services, making up a significant proportion of the health and care workforce. Also the expertise and flexibility that the sector bring in how they work. So the assets that they may bring to the table that complement the statutory sector. The third reason is the links and relationships that the sector has with communities, whether that's in relation to particular health conditions or geographies. And then finally is the sector's perceived credibility and trust in working in those communities. So what I'll do now is, having sort of set the scene for why we might want to work more closely with voluntary sector organisations, is to go on and talk about a local example of how this is being progressed in Lancashire and South Cumbria. So the system here is, it covers a region which is made up of 5 local areas, which are illustrated on this image. And then in each of these localities, there's an integrated care partnership board, which oversees local activities. And then cross-cutting that, there's a ICS or Integrated Care System Board who oversees work across the region. So I'm conscious that I'm sure I've massively oversimplified those structures and what happens in the region. But really the most important point for this presentation is that the ICS in this area has placed a particular focus on engaging with VCFSE organisations, and is developing a model to do that, which is what I'll go on to talk about next. The voluntary, or the VCFSE Alliance in the area is a structure which has been established, and that's a group which is made up of representatives from the sector in each of the 5 localities I've just described. It meets regularly as a group, but importantly, it also links into the local ICP boards in each localities through representatives from VCFSE organisations, and they sit on these boards. There's also an independent chair called Peter Armour. I've included a quote from him, or an extract from a quote, which comes from a statement he made, and that sort of highlights the vision for the Alliance and the importance of the VCFSE sector being a major player and equal partner in the planning and delivery of health and care services. So between October and December, my colleague Annabelle Edwards, as a member of the team, carried out a series of interviews with representatives from the Alliance. So in just this next bit of the presentation, I'll just draw attention to some key findings from how the Alliance has been developing locally. So firstly, to reflect on some of the early changes and benefits that were being brought about. There was a sense that having this alliance is providing the opportunities to strengthen and develop new relationships actually between VCFSE organisations. So that was giving people, for example, a greater collective goal to work or voice to work towards a shared goal, but also to voice and to articulate common frustrations. But there were also as well examples emerging of how organisations were now sharing information or working more closely together on funding bids, which doesn't traditionally happen due to quite, very competitive funding environments for the sector. Secondly, representatives we spoke to also talked about this structure providing some increased opportunities for voluntary organisations to engage with these structures more formally and bring their knowledge and expertise to the table. And then finally, we've heard in other presentations, and in Fiona's presentation, there's been the influence, obviously, of the pandemic, and this really sort of illuminating the importance of the sector in responding to local community need. Alongside this, the research has also drawn attention to ongoing challenges in working in new ways of working, which have a stronger partnership approach with the VCFSE sector. So I've just highlighted some of these here for your consideration. So they firstly quite practically relate to the sort of time and the funding that's involved in organisations taking time out of their day jobs. So the need for that to be recognised, not just assume that people have the capacity to do that. Also related to funding is the issue around how the sector is funded, the sense of competition there can be for funding, particularly within increasingly challenging economic circumstances. Then a second key point related to the capacity both of statutory organisations and voluntary sector organisations to work together in new ways. So that included, for example, the need for a cultural shift in maybe how health organisations view the VCFSE sector as being more than organisations that are commissioned. And then that, I think, was contributing to an extent that voluntary sector organisations genuinely feel that they have parity of esteem compared to their statutory partners. And perhaps reflected in this quote where the individual's talking about the challenge of perhaps sitting around a table with a very large health organisation if you're quite a small community group in an area. So that's really concludes my presentation to sort of draw attention to the increased focus on partnership working with the VCFSE sector and the need for sort of approaches and ways that formally support how that's done. So as we move forward, we sort of broadly think there are perhaps two areas we can take this in, and again, hopefully there will be other ideas that come through the discussion. So one of the issues is perhaps there's more to be done in really starting to unpick what the contribution and role of the sector is, alongside statutory partners. What's the unique contribution that the sector plays or is playing already? And what does that mean for patients and communities and ways of working in services? Then secondly, of course, as an organisation, we're interested in building the evidence and looking at how we evaluate interventions and programmes that involve working in more joined up ways in the region. And perhaps there's an opportunity to learn from approaches that have emerged through COVID. So thank you, Paula.
Thanks, Emma. Now we're going to be taken into breakout rooms once again. I mean, I know that it's a short amount of time. For our purposes, I think it'd be interesting to focus on the question around the implications of the research that you've just heard on your practice or your community or your organisation. We have got a report that's been produced as a result of the project. So if you're interested in receiving a copy, then contact us at the team or stick your details in the chat and we'll send one out to you. Obviously, we've only had a short amount of time here to relay the work we've done today, but it's an emerging and growing piece of work, and certainly with those with an interest in policy, the role of the sector and how it is being developed further as these integrated health and care systems develop is going to be a really key thing moving on in the development of these new emerging systems, and it will absolutely have an implication for applied health research in this setting. So Sam, if you want to put us into our breakout rooms, that would be great. So we've got 6 minutes for you to discuss what you've just heard from Emma and implications around where you work, whether that be community or whether working local authority. We'd just be interested to hearing your views from what you've heard. Thank you.